the study I presented is the RFCT from the French Cooperative Thoracic Intergroup 0302 trial. It's a randomized phase 3 multi-center trial which compared two follow-up programs. Patients were randomly assigned to minimal or maximal follow-up after complete resection for non-small cell lung cancer. Minimal follow-up consisted of clinic visits with history, physical examinations, and chest X-rays. And in the maximal follow-up arm, patients also had chest CT scans and in case of non-adenocarcinoma histology, fiber optic bronchoscopies.
And what were some of the clinical outcomes, the comparison looking at median overall survival and benefits of risk going forward?
The primary endpoint of the trial was overall survival, and the study did show that there was no difference in overall survival between both arms. So with the addition of CT scan in the follow-up, with a 3-year survival rate of 77% in the minimal follow-up arm and 76% in the maximal follow-up arm. Yes, well, the later parts of the curves diverge, so we did an exploratory analysis looking at the landmark analysis at 2 years. In patients who had disease recurrence at 2 years, there was no difference in survival. However, in patients who had not developed a recurrence at 2 years, CT scan-based surveillance seemed to significantly improve survival. The reason why is probably because earlier detection of recurrences within the first 2 postoperative years did not translate into survival benefit because it reflects aggressive disease. However, beyond 2 years, patients are more at risk of second primary cancer than recurrences, and these second primary cancers might be more amenable to curative treatment and might benefit from CT scan detection. Looking at the results of the trial, we could say that both follow-ups are acceptable. However, I think doing CT scans every 6 months is probably of no value. It's too frequent. And keeping long-term, yearly CT scans might be of interest since there might be a benefit of survival over the long term. Well, we will have more because we had several secondary endpoints, including health-related quality of life, just to see whether patients were either reassured or anxious about their CT scans. Also a cost-effectiveness analysis and the prognostic value of gene signatures that are currently being analyzed.